How do X-rays help diagnose osteoarthritis from other arthritis? Imagine trying to solve a puzzle about what's causing your joint pain. Doctors use X-ray images as a key piece of that puzzle. They look for specific signs that tell them if you have osteoarthritis or another type of arthritis. X-rays are often the first test used because they are quick, affordable, and give a clear picture of your joints. When osteoarthritis develops, it creates four main patterns on the X-ray images. The first is joint space narrowing. This means the gap between your bones gets smaller because the cartilage that cushions your joints wears away. A healthy joint has a wide space, but in osteoarthritis, this space shrinks. Next, there is subchondral sclerosis. This appears as a wider, denser area around the joint on the X-ray. It happens because when cartilage is lost, the bones rub against each other. Your body responds by making the bone denser to protect itself. The third feature is osteophyte formation, which are small bone spurs or bumps that grow at the edges of the joint. These develop as your body tries to stabilize the joint after cartilage loss. The last pattern is cyst formation, also called geodes. These are small cavities or holes in the bone that form as the disease progresses. When doctors see these four features together on an X-ray, they can confidently diagnose osteoarthritis. Other types of arthritis, like rheumatoid arthritis, show different signs. Rheumatoid often causes uniform joint space loss and bone erosions, but does not usually produce the bone spurs seen in osteoarthritis. Instead, it may affect many joints symmetrically and cause more inflammation. X-ray images also help doctors see where the disease is affecting your joints. Osteoarthritis tends to target specific areas like the knees, hips, hands, or feet. The pattern and location help confirm the diagnosis. Doctors use a grading system to describe what they see on the X-ray. Mild osteoarthritis shows some osteophytes and slight joint space narrowing. Moderate cases have more osteophytes and clearer narrowing. Severe osteoarthritis displays large bone spurs, significant joint space loss, and sometimes joint deformity. To get a full picture, doctors often take multiple X-ray views. They may do front-to-back, side, or angled images. For weight-bearing joints like the knees, standing X-rays are best because they show how the joint functions under normal pressure. Sometimes, special views are used to catch early signs of cartilage wear. X-rays are especially helpful once osteoarthritis is well established. But in early stages, cartilage doesn't show up on X-ray because it is soft tissue. If your symptoms suggest osteoarthritis but the X-ray looks normal, your doctor might order an MRI. An MRI can see cartilage directly and catch early disease that X-rays might miss. Overall, X-ray images are the go-to tool because they are fast, inexpensive, and reliable. They reveal the characteristic patterns of osteoarthritis, helping doctors tell it apart from other joint conditions. This allows for quicker treatment and better management of your joint health.